Okay, I think we're going to go ahead and get started. Thank you all for joining us today. We're going to be going over your alternative healthcare benefits, and my name is Denise Gruden. I'm your Medicare sales executive with Western Health Advantage, and we're going to go over a little bit about how to get started with Western Health Advantage if you haven't done so already, how to access your alternative care benefits, and which includes your eyewear benefit. This is in addition to your core benefits that your plan provides. Again, my name is Denise Gruden. I'm the Medicare sales executive with Western Health Advantage. Okay, so I see a few of you that have been on our previous webinars, and hopefully you've already created your online account. This is your MyWA portal. This will take you everywhere you need to go with Western Health in regards to finding your plan benefits, your documents, or links to the different value-added benefits that are included in your plan. Oops, sorry about that. This is accessible 24 hours a day, 7 days a week, and it's very simple. You'll log into this wha.org/mycare login, and it'll bring you straight to the page that looks like this over here. And you'll log in with your name, your password, or create one by registering down here. This truly is your gateway to all things benefits. Okay, today we're going to be reviewing your chiropractic, acupuncture, and eyewear coverage that are included in your MyCare plan, and this should only take probably less than 30 minutes. It's pretty straightforward. However, if you have any questions, again, please use the chat box, and we'll get those questions answered for you. Your chiropractic and acupuncture benefits are administered through our partner with Landmark Healthcare. They're considered an alternative medicine to traditional medicine. So when you seek chiro or acupuncture, you will choose from the Landmark Healthcare provider listing, which we'll go through. Okay. Seems a little slow today. Okay, so your alternative medicine can help you, it can help you alleviate pain-related issues. Many conditions that are affecting your neck or your back or your joints, they can be eliminated or relieved at least through alternative health rather than the traditional medicine. Some folks use this in combination, but I personally have used both chiropractic. I haven't used acupuncture, but I've used the chiropractic for some of my, let's just call them ailments, and it has helped considerably. It also has been known to help with asthma and allergies. So it's a great option to have, and you do not need a referral to seek a chiropractic or acupuncture provider. So, again, a PCP referral is not required. You have direct access to the Landmark Healthcare providers. You can go to the Landmark website, which we'll go over here. It's included in your welcome packet and through the MyWA portal. With the MyCare benefits, you have up to 20 combined visits available to you per year. If you're on the MyCare or the MyCare Compass plan, you have 10 visits combined per year, more if your doctor thinks it's necessary. And on the MyCare Plus plan, you have combined 20 visits per year. Now, this is subject to the individual Medicare plans. If any of you folks are from a commercial or group Medicare plan, your plan may vary, or the benefits may vary, so please refer to your evidence of coverage for your exact benefits through the alternative care. For either chiro or acupuncture, your copay is $20. So that'll stay the same with any one of these plans. Okay, again, for any of our plans, if you're trying to reach the Landmark Healthcare provider line, the phone number is listed here as 800-298-4875. or you can simply visit the website at lhp-ca.com, and we'll go through what that looks like here. Once you log on to the Landmark site, you'll want to come up here and click on, there's a lot of information here, so I encourage you to read through it. But if you want to go straight to find a provider, just click on the button up here. I don't know if you can see my mouse moving, but there's a find a provider in the gray bar. And once you click on that, it'll bring you to this next page, the provider directory. You'll click the plan, which is Western Health Advantage down here, that big arrow is. And you can narrow this down to radius from your house or from your work, or a specific location, and just really dial it down to what you're specifically looking for, and it'll give you a whole listing of providers that meet that criteria that you've put in. So I invite you to, even if you don't need a chiropractor or an acupuncturist, go ahead and check out each of these websites just to understand how to find what you need, and not wait to the last minute till you need it and can't figure out how to find it. So this is a good tool to practice. Oops, my clicker's not working very good. Okay, so in addition to finding the provider, you can also view chiro and acupuncture benefits on the Western Health Plan through your portal. So you have two resources to finding your benefits, either through the MyWA account, which is your member portal, or the Landmark website. If either of these give you any trouble or you're confused, you can always call our member services department, and they'll help navigate you through either site. You've got three resources. Okay, so now we're going to talk about your vision. So if you're new to Western Health Advantage, or even if you're a returning member, I just want to reiterate that the MES Vision is your eyewear benefit. You do not get your eye exam through MES. You do that through your medical group, and we'll go through those steps here. But basically, you're eligible for your annual eye exam through your Western Health Advantage participating optometrist or ophthalmologist. So your eye exam is covered through the medical group. And when you receive your prescription for the eyewear, you'll take that prescription to any MES Vision provider, which stands for Medical Eye Service, to fill for your glasses, your contact lens, your eyeglass lens, or your frames. So the MyCare plans include the eye exam each year. And again, I'll just reiterate, you're going to get this exam through your medical group. We've had some members try to set an appointment to get their eye exam through MES provider that's not in our network, so that will not work. You have to go through your medical group. You do not need a referral from your provider. Simply go on to our Find a Provider and search for an optometrist or ophthalmologist. Again, if you need assistance, member services can help you with that. All right, so your annual eye exams, again, are covered under your plan. You can simply look up an optometrist or ophthalmologist on the provider search tool on the Western Health site. You can go through the WA portal, or if you do go through your Western Health member portal, you can actually book your appointment right there. So that's convenient. And you'll find you'll see when your available appointments are. Again, dial it down to location, distance from your home or work, or whatever's convenient for you. So your benefit, your value-added benefit for the lens, frames, or contact lens is one pair every 24 months. This is unless you have a change in your sight. And that could be anything such as a 0.5 or half a point diopter change, or a shift in your axis, or a astigmatism of 15 degrees, or even a difference in your vertical prism, which is greater than 1 prism diopter. All of that is foreign language to me, but basically, if there is a specific change in your eyesight, per these guidelines, it actually makes you eligible to replace your lens every 12 months. So your frames are every 2 years. If you have a pair of glasses that you just fell in love with, the frames, you'll want to take those frames with your new prescription at 12 months and have them filled. Hope your original prescription just helps you. So here we go. You know, what are your options for the prescriptions? Typically, you can take your prescription, or people fill their prescription right there at their ophthalmologist or optometrist office. They usually have a material dispensary right there in their office. So you can choose your glasses from what they give you as a choice. Or you can take that prescription and go out to any MES provider, which includes major chains like LensCrafters, Stanton Optical, Target Optical, Walmart or Costco, and kind of look around for a wider choice, or maybe more bang for your buck, so to speak. You do not have to be a member of Costco to use this benefit. Costco is actually one of our prescription providers. You also, again, you don't need to be a member in order to use the Western health benefits that are available to you with Costco as an option. Okay, so to find a MES provider, you can simply call the phone number and talk to the member services at MES, or go to their website, mesvision.com, dial it down to your location. It's really simple, and you'll be surprised how many providers there are. These numbers are also included in your welcome brochures, and I see a couple repeat webinar attendees here. If you did not receive your welcome brochure, then I did email it out to everybody, but if you still need it, which lists the phone numbers for all of these benefits we've been talking about in our webinars, go ahead and send a little note in the chat there, and I will see it, and I will send it to you again. Okay, so MES Vision, once you log on to the portal, this one's a little smaller and harder to find. It's funny because it's the eye benefit, but it's right here at the top. You'll click on Find a Provider. And once you find that, again, you can dial it down to your criteria in what you're looking for an eyewear benefit provider. Location, name of store, distance from your house, etc. It's all pretty simple. Just got to get in there and play around with it. Okay, so again, that was pretty quick, but it was pretty straightforward. We've gathered all of this information in one easy to access site at mywha.org/mycarebenefits. And I'm actually going to stop sharing my screen for a moment and pull up a different, let's see if I can, actually, let me see if I can do this. Let's go to, okay, can anybody see my, can somebody send me a chat message saying that you can see my screen or what you see on the screen?
Denise, what we see is the PowerPoint with the slides to the left, and it says plan coverage. Let's talk benefits on the main screen.
So, okay, so you don't see the value added benefits yet. Okay, so I'm going to stop sharing my screen for a moment, and then I'm going to reshare it right here. So I want to show you what you'll see when you log in to the My Care benefits page.
And we can see it now.
Good. Okay. So when you log in to the mywha.org My Care benefits, you're going to see all of the value added benefits. Some of these we've already talked about. got your virtual care, dental care, which we haven't talked about yet. Hearing aids we've covered, and the over-the-counter emergency assistance. It's all nice and tidy in one place. You can access all of it. And so you would click on order products for your first line. And then here it tells you what to do, little links here. So these real faint green things, these are your links to the site. So in this case, this is the over-the-counter benefit. And so you would log in or create an account, etc. So I just wanted to share that with you. This is what you'll see when you log in to that website. Okay, so we're going to go back now. I don't know why I can't do multiples, but that's okay. All right. Does anyone have any questions? Do we have any questions, Eric, that you see?
No, wait, something just came up here.
Oh, where can I find the recorded versions of these webinars? Good question. So, Raymond, I'm going to let you help us out with that. Oh, I think he's left us, hasn't he? Did Raymond leave? No, he's still there.
I'm still here.
Great. So, Raymond, when will we have the recordings posted? Are we going to do the recordings after the last webinar that we have?
No, so we have started, as far as I'm aware, we have started posting some of the, I think 2 or 3 of the previous ones are on our YouTube page.
Oh.
I believe
Okay, what's the
they're going to be on the same page that you find the information for the webinars. They're going to be on that page. There's going to be a link. I know the marketing department is working on that. I don't know if the page has been updated yet with the YouTube link, but I believe it will be. And all the rest of them up until today, I was told, will get uploaded by end of day tomorrow. So all of them should be up by the end of the week.
On the YouTube page, okay. But the YouTube page isn't necessarily posted on our consumer website yet, correct?
It may be. I haven't checked. I was just made aware of that right before this meeting today, or this webinar today in our meeting. So I haven't been able to check that yet, but it may be there already.
Good, I'm gonna look. Let's try. Thanks for your patience, folks. Okay, let's see. Can you see my screen, Eric, or no? Okay, that's okay. I don't know where we're going to find it, but I'll tell you what. Everyone that's on this webinar, we will go ahead and let me get out of here. Let me get out of all of this. Let's see. Okay, where am I back to here? Am I back to our screen?
Yeah, Denise, it's showing your plan coverage with the slides on the left. I think you just need to optimize the slide presentation to fit your full screen. I think you'll be good.
Thank you, Eric. Okay, which I don't know that not letting me. I don't know why. Sorry about that. Okay, so what we're going to do is I'm going to email everyone on this webinar and let you know the exact location of those recordings or when they will be available in the show here. I don't know why I can't get my screen back. I'm so sorry. There we go. Okay, so here we go. There. And it's not letting, oh, I see what's the problem. Here it is. It was hidden. Okay, there we go. Back to, okay, so let's move forward here. The next webinars we have coming up on the 28th of February, you will hear all the details on how to take advantage of your post-discharge meals with Mom's Meals. You guys, please don't miss this one if you haven't attended one before. They have delicious meals, and the presenters from Mom's Meal do such a great job. You'll be hungry and online ordering, even if you don't even if you're not post-discharge, because you do have the options of buying their meals. And I've heard great things about them. I haven't personally tried them, but I know they have a cherry cobbler that a friend of mine did order and just loves. So check them out, and please register for the 28th, Mom's Meals. Your navigator, I think, will be our friend on the line here, Eric Greathouse. He's my co-worker here at Western Health Advantage. And on the 2nd of March, we have the presenters from Delta Dental going over your Delta Care USA benefit. So you don't want to miss that either. So 2 great meetings coming up after this. And then we will send you the information on the webinars recordings where you can access those. Also, you want to revisit how to get the value added benefits page. Okay, yes. So how you get to the value added benefits page is right here. Do you see this? mywha.org/mycarebenefits. Put it right in here. Okay, it's MyWA. There we go. Oh, I think I just sent that to here. Sorry. Did everybody see that? I'm not doing so good. I apologize.
Yes,
I'm having
it
a
looks
few,
like she got it.
Huh?
She got it.
Okay, good. Thank you. All right. Well, thanks for being patient with me. I'm having some issues with my keyboard and my screen. So again, don't miss our benefits meetings coming up. And then if you have any additional questions, please go ahead and ask us now. We're here and ready to help you. Eric, do you have any questions?
I do not.
You don't, I mean, do you see any?
I don't see any. That's right. I don't.
Okay. That's okay. All right, folks. Thanks so much for joining us. We appreciate you. We're grateful you decided to choose Western Health Advantage, and we look forward to a long relationship with you. If we can answer any questions that you might think about after this, go ahead and contact us at the, let's see here, you can contact us at 888-942-4777, and we're on the sales side. But once you click on that, just tell them you want to talk to the sales folks for Medicare, and we'll go ahead and answer any questions you have. All righty then, I'm going to go ahead and sign off for us, and you all have a wonderful, healthy day. Thank you.